Affairs and Advocacy at APHA, and we are looking forward to a really great meeting. Our main focus today will be a presentation from the White House around 2:30 about the avian flu. But in the next 30 minutes, we do have the opportunity to hear from some short updates from the Alliance, from IP3, and some new features of the Public Health Equity and Resource Navigator. Once we also be able to hear from the Public Health Communications Collaborative, describing their available resources and tips about how to communicate with the public and other partners related to some of the emerging infectious diseases that we've seen recently. So it is going to be a very full hour. Just want to briefly, because we don't have a lot of time, talk about some of the milestones. April is National Minority Health Month, aimed at raising awareness about health disparities that affect minority and American Indian populations and encouraging action. Remember that our annual meeting is coming up in October in Minnesota. Registration for that will open in January. The Policy Action Institute registration is open. We are also, as you may know, selling the policy engagement book by some of our colleagues at Hopkins and Beaumont, and that is also being sold at a discount for the meeting. So if you have a chance to check out the website, the agenda is coming together, and we hope to see all of you in June in DC or virtually. Let me now hand it over to Angie to begin our brief presentations with some updates from the Alliance.
Thanks so much. So it's great to see everybody. We'll be very quick today, but just wanted to tell you a little bit about what we've been doing here at the Alliance as we're trying to think about next steps and how we can start to move towards building that robust and resilient public health system that advances health and well-being for all. One thing we're very pleased about, we had a commentary that came out in May as part of a special issue or section of the American Journal of Public Health. The focus was on the future of the Institute or looking at the Institute of Medicine, Future of Public Health from 1988, and thinking about where we've been. You will see a number of Alliance partners, but we're pleased that we were able to submit a commentary, really sharing some of those lessons that we've learned from engaging with all of you all, from thinking about the pandemic, from looking at recommendations, national recommendations and others over the last few years about where we need to go next for the public health system. What you can see, and we've shared the commentary and will again, really is just that we think we know a lot about what needs to happen next. We've all talked about the need to engage community, to have a broad public health system, to really start figuring out how we can advocate and take action to really let people learn about public health and where we need to go next. And it's just time for us to try to start to take action and to move some of those. I think looking at the election coming up this year has certainly inspired a lot of us to realize that there's some things that we need to start to do together to start to let people understand the value of public health and what we need to do next. So with that, just you can please see some of the lessons really on how we think the system needs to adjust and where we think the Alliance can be especially helpful. In general, though, this will show you some of the roles we think for the Alliance are what we've been doing, really connecting and collaborating with partners. We know there are a number of amazing things happening out there. The last thing anybody needs to do is duplicate efforts, but we really think there's a place to come together and learn how to collaborate, to really do collective action and programming and thinking about where we're going next. And that's something with our cross-sectoral group, with all of you all, we think is a place for us. We hope to be the table for convening and learning about the public health system, thinking about things like advocacy and community, thinking about how we can support equity and move populations together. We especially think that it's time for advocacy for public health. There are amazing things that happen with partners at the federal level. Individual states and focuses have areas and communities are good, but we need to have a comprehensive infrastructure that allows us to really start to put proactively out there a vision of where we need to go for public health. And that's something that we would love to collaborate with all of you all to think about how we can start to advance and build. So we'll tell you more about that over the months to come. But as our title for the article says, which is 36 years after the 1988 Institute of Medicine, Future of Public Health, we think it's time to stop ruminating and start taking action. So we're trying to do some of that ourselves. So one thing that we will do, we heard some key areas that we think are places where the Alliance can work, and that are really important to the system. So one of them is thinking about how better to include community collaborations. Steve Greeley and Shared Cause will help us continue to bring partners together to think about how we can better support that type of partnership, knowing that there are many things happening. And once again, this will be a place to work with partners to figure out what else is needed, what are the gaps, and what's happening. We know strategic communication is something where there's a lot out there on what is the value of public health. How can we work together on that and think about how we can strategically start getting information out to different partners and what's needed, what are those gaps to help us move forward. Additionally, supporting states. I think specific examples would be, in the past, we've seen challenges to public health authority. We now see some states making exciting efforts to transform public health. What can we together do to help support those efforts, both through technical assistance, through convening, or through advocacy? And then things like the workforce, bringing in funding. These are all areas that we think are important, and we'll try to bring together partners to think of how we can start to develop an advocacy infrastructure and what are those needs together that we can work on to move forward. Otherwise, we're also trying to think about what we need to do to change our focus. As you know, we started during the pandemic, bringing together the partners to think about how we could move forward together through the pandemic, how we could help to support public health. We believe we're now in a space where, the goals we've talked about that are needed around the future of public health, we need to think about how to broaden our table and figure out what we can do differently to help to take action. And so we'll be thinking about how to redo these meetings a little bit, and stay tuned for that. We're thinking about what we need to do in terms of activities. The working groups are an example of something we think are a step we can take now to start to move things forward. And then in general, I think one big thing we've heard from some people is that our name, while it might be very appropriate for today, the Alliance for Disease Prevention and Response, may make some people think that we're really just focusing on infectious diseases. We're not thinking about the big picture view of public health that I think we've all think is so important. And so maybe we need to think about changing our name. So if you'll go to the next slide, one thing we have considered and would love to get your thoughts would be whether our new name should be something more like the Alliance for the Public's Health. We think stressing the public is important, and so that's why the apostrophe S is an important part of it. But feel we would keep kind of the same look and feel. The Alliance part is really key, but thought this broader focus might be important. With that, I'm going to take it off slides for just a minute, and if people want to either add an emoji or add in the chat whether this seems like it would be the right way, we wanted to run it by you all. And if there's a group that's similar, let us know. But this is a thought for us on what might be a good way to be a little bit more all-encompassing, but led us to keep our same vision and goals. Any thoughts? Good. And if you all know, we also want to know if there's anything too similar. We haven't seen it, but this is why we're turning to our experts, all of you all also. So thank you. Good. I'm seeing positive steps so far. So with that, just stay tuned. We're really looking forward to moving this forward with all of you all to figuring out where we go next. And so we'll keep focusing you or keep it moving ahead going forward. And Takesha, we'll share those slides once we're done. And please do consider it. That would be great. With that, I will hand it to our next presenter. We're going to let Sarah Ivy tell you a little bit more about one of our favorite Alliance resources, which is the Public Health and Equity Resource Navigator.
Thanks so much, Angie. It's great to be here with the Alliance again. I've had the pleasure of getting to present in the past about our work together on PHERN, the Public Health and Equity Resource Navigator. I'm Sarah Ivy from the Institute for People, Place, and Possibility and the Community Commons team. And if you haven't been on PHERN lately, I would suggest going on PHERN. The user experience is better than ever. We have added some new features in the last couple of months that I wanted to highlight, as well as some of the new resources and tools on the site. I wanted to note that we have new accessibility features on the site. You can see expanded out version of the accessibility tool. So this makes it even more friendly for all people to access and get and use the site. We've also improved the navigation. So you'll notice some more sophisticated drop-down menus, and hopefully it makes it a little bit easier to get to the content that you're looking for on the site. I want to speak about some of the really exciting content work that we have launched in the last few months during the APHA annual meeting and expo last year. We launched the Fundamentals of Public Health Learning series. It's a 5-part series. You can see the learning modules up here. It's that Public Health 101 content that newcomers to public health are wanting. So it includes a little bit about public health, about health, well-being, and equity, dives into vital community conditions, the 10 essential public health services, and helps newcomers to public health see themselves as stewards of the public's health. I won't go into each of those modules. I hope you'll explore them on your own. I did want to just zoom into the essential public health services module. It's a really neat module, interactive, with 10 different linked pages. You can see here I have a screenshot of the authority essential service. So you'll be able to navigate, users can navigate from there, learn a little bit about the essential public health services, and drop in to learn more. You'll find a description, how that essential public health service connects to equity and systems, how public health advances it, and what are some of the priorities as delineated by many of the plans that I know you all have contributed to. We've also included reflection questions on all of the modules to help integrate that learning a little bit better. We want to share the media kit that we developed for the Fundamentals of Public Health learning series, so that you all have all those resources that you need to share it with your audience. Please consider adding to your future shares in social media, link onto your website, including in your newsletter and beyond. Some of you may be aware of some of the Public Health Authority resources on PHERN. We have our topic page, and then we've recently added a toolkit, which is that, if you all are probably familiar, Raya, I know you developed the toolkit, that expandable. It's expandable here, but organizes resources that are being shared around Public Health Authority, as well as a portal where users can find all of those resources in one place. This is supporting some deeper work that we've been advancing, which is not live on the site today, but that we look forward to sharing with you very soon. It's the Taking Action to Protect Public Health Authority learning series. That series is in 3 modules. Chapter 1, the basics of Public Health Authority. Chapter 2, Public Health Authority under threat. And Chapter 3, advocating for public health authority. The learning series also includes several take action guides, including guides for affiliates, community residents, and students and young people. You'll also find a series that we hope to grow over time about advocacy stories for affiliates. There are 2 to date, written by Ursula on the APHA team. That's what I wanted to share today in terms of an update. Hope that you all will join us on the site, and please share with your audiences.
Great, thanks so much. I now have the pleasure of introducing Jessica Malati Rivera from De Beaumont Foundation, but working with the Public Health Communications Collaborative. She'll have a chance to tell us a little bit more about communicating about emerging infectious diseases. And specifically, they have some great resources that I'm glad you'll have a chance to tell us about. Just briefly, Jessica is a science communications advisor with De Beaumont Foundation. She's an infectious disease epidemiologist and science communicator with 15 years of experience in emerging infectious disease surveillance, vaccine advocacy, and public health policy. She's been recognized for her work, including as one of the world's 50 greatest leaders by Fortune magazine in 2021. She has a number of different positions otherwise, and has a master's in science from Georgetown and is currently pursuing a doctorate in public health from Johns Hopkins. So a great person to give us some information now. And Jessica, I'll turn it over to you.
Thank you, Angie, for the introduction. And I feel like this is a perfect follow-on to what we just heard from Sarah as far as resources that are available to help public health professionals and leaders communicate in times of emerging infectious disease outbreaks, uncertainty, disinformation, et cetera. And I have the great privilege of working closely with the Public Health Communications Collaborative, which is a group effort done with the Diploma Foundation and the CDC Foundation and Trust for TIFA, Trust for Health in America. And the work that they're doing is essentially to create resources in a very reactive way to emerging threats so that they can be evidence-based and easy to find resources that can be truly used and widely distributed as fast as they happen. And there's two examples that I want to give as far as the reactiveness of PHCC. We can think about the measles outbreak and also HPAI, highly pathogenic avian influenza, the H5N1 outbreak that is happening truly within moments of these outbreaks emerging. The PHCC team is working very closely on creating messages, answers to tough questions, and how to communicate ideas in moments of uncertainty, communicating what we know and what we don't know. Next slide, please. So these are the kind of four major outputs that we have at PHCC. We're providing messaging, which is quite literally actual messages to share to wide audiences, provided in lay language that are accessible by wide peoples of various literacy levels. Answers to tough questions, and we field these questions based on what we hear through our monitoring, what we've heard in our own observation online, frequently asked questions, etc. Sometimes we provide misinformation alerts too. If there is a circulating claim or rumor that needs attention, there is an alert that gets sent out to those who subscribe. I highly recommend going to PHCC or publichealthcollaborative.org, signing up for these alerts. It really is not an overwhelming influx of information. It's quite balanced, and I would say that our click open rate is very high because of that, because it's very reactive. It really doesn't do too much, as well as monthly webinars, which are one of my favorite assets. These are decided very well in advance topically. We just did one on the values of visualizing data and what that can do to inform public trust in health information, and how we can help public health departments become better users of data visualization tools for the purpose of communicating science and public health information. Next slide. And then this should be hopefully it works, but a quick little video of kind of what happens when you get to the PHCC website. If you scroll down here under the messaging resources, you'll see here an example of measles. There's top line messages. That'll be very quick answers that you can copy and paste. It'll give you tons of resources, talking points, frequently asked questions. It is often going to cite the CDC. It's going to cite very credible sources. It's also going to say what we know and what we don't know in a number of places, because again, part of the resource here is not to just provide definitive answers, it's to communicate things that are still emerging, like the case of HPAI. It is an emerging outbreak. There are lots of unknowns, without causing panic and harm to those who are trying to come to us for those trusted messages. So again, this is for HPAI. We just worked on this as recently as last week and have been finessing it, providing up-to-date resources as the data has become available. It is a very active conversation on the back end of these channels to make sure that as information is available, it is updated in real time. And again, if there are opportunities for folks here to provide feedback, or if you are interested in knowing how this work happens, I'm happy to answer those questions, but wanted to share these resources with you and know that all of the stuff that is created, even in the format of those webinars, is archived on our website. So even if you miss these events, miss the alerts, it's all available and very searchable in a user-friendly way on the website itself. So we've got an archive of every single monthly webinar that we've just had, including a transcript of the entire conversation. I don't want to speak too much longer because I know we're tight on time, but I can be available for questions after the fact.
Thanks, Jessica. That was great. And we are actually doing pretty well with time. So thank you to Sarah and everybody for going pretty quickly. I will let people ask questions, but just first, I know we made you go pretty quickly through that. do you have certain recommendations for talking to, I don't know, you're at the dinner table with your family or some colleagues? How can we talk about something like measles or this pandemic flu in a way that'll let them get enough information that they're following it, but aren't completely freaked out, and
Yeah.
also build some of that trust that I know you mentioned?
Yeah, it's an excellent question. And that's why we have a section called Tough Questions. We imagine those dinner table conversations. We're imagining those holiday reunions. We're imagining conversations with your pediatrician if you have children, so that folks can see probably things that they're thinking that they haven't been able to articulate, things that they've seen online, claims, rumors, or just trends that they have been following, with very clear answers to those questions. Without trying to cause panic, spread more of the infodemic of too much information, dis, and good information, which can be very overwhelming for folks to navigate, as well as pointing people to trusted resources. So part of that trust building work is showing folks how to become better consumers of information, to build their science and data literacy. And in doing so with the PHCC Collaborative or the PHCC website, we're trying to help people be better navigators of this infodemic that we're in, so that folks can look at the tough questions, find the citations there, and see for themselves how they can make better informed choices for themselves and for their communities.
Thanks so much. Scott, I see you ask a question, and I'll let you ask it in person if you'd like.
Sure. No, thank you, Jessica, for this. And I think you just ended well to help people make appropriate decisions. And obviously we're all working in health literacy and so forth. So my question I put in the chat is in the middle, in your presentation, you said, we're going to update the information in real time. And it sort of begs the question, where is the information coming from that's the trusted source? Do you wait till it's published in KFF, the Washington Post? Is it if there's a new thing on a CDC site, WHO? Where is this? And then real time means what? What is the lag? And then, of course, posting it. And then what are the refutations of the points that are there? So thanks.
It's a great question. I think real time perhaps is a bit subjective because it's not immediate. It's not just a scraper of the internet that is posting in actual real time on a heat map of the news sources that are coming through. Rather, it is a very exhaustive vetting and research process that is using only credible sources. I mentioned earlier, we're citing the CDC a lot. We cite the WHO a lot. We're citing peer-reviewed journals, journalists who are kind of well-versed in the subjects. If there are emerging guidelines that are coming from CDC or even the White House, that is often discussed. One of the examples recently is the change in guideline for isolation. We updated them as soon as they came out because we had a section on guidelines for isolation and quarantine that needed to be revised per the most recent change. And we keep the old one as a kind of to show the evolution of it, to say like, this is what it was at this point, this is what it is now. And so there is a lag, of course, because there is a very, large-ish group of folks who are trying to make sure that the way that we're writing it is accurate, is true, is understandable. And we have a number of people who have to sign off before it hits the website.
Okay, thanks. It is a big challenge, like you're saying. And, if we just look at the bird flu, the avian flu, and of course the Mpox is some example, but COVID, we're still, unfortunately, the postmortem is not so great. So,
right.
Yep.
So we have a couple of minutes, so not sure if people have other questions or if there are things that, before the White House joins us, are there things that you're seeing out there around the country about avian flu or measles or others that are things you think we should be following or we should deal with?
Are you asking me?
Oh, it could be for you, Jessica, if for anybody. Okay, no other questions. Jessica, I will ask you all one more, and this may be for Mark or others too, but are there other things that you plan on building or focus areas that you all are planning on taking on as part of the PHCC in the next months to come?
Yes. So I think COVID-19 took a large amount of our attention for justifiable reasons, but the purpose of this is to be very, very diverse in our touch points on public health issues. So it should include a number of topics related to not just emerging infectious diseases and things of pandemic potential. It'll include many issues in public health as far as how they impact daily life, how they impact people's decision-making for their own health. And so you can stay tuned for more updates on PHCC. You can see kind of the subject as they're categorized on that website. But it is definitely intended to be much, much more broad than just emerging infectious diseases and viral outbreaks.
We'll look forward to seeing. So since we have a couple of minutes, other updates people want to add to the chat or tell us about? Or Sarah, I see you raising your hand.
Yeah, I did want to just one comment. I've been doing some private chats here, and did want to share with everybody that on PHERN we do have the ability to promote new resources and events that your organizations or your partners may be sponsoring. Didn't highlight that here, but if you have any upcoming events, please do reach out and share those. We'd love to promote them on the site.
Great, thanks. It's a little bit of a hurry up and wait, but yes, if there are other things people want to update us on, please let us know. Well, since we have a minute, I think still, Steve, I know I had mentioned that we were bringing together people a little bit around work groups. Do you want to tell people just a little bit about what you were thinking about around the community collaboration work?
There we go. I'm glad to do that. We're in the process of, we have had a working group in the past year that was identifying what might be the elements of a system of support for community collaboration. And so for coalitions and for people in positions that coalitions would want to be working with. And those elements encompassed providing support, guidance, if you will, for coalition formation and management, technical assistance. There's lots of good technical assistance around the country, but how to help communities come together to make the best use of it. We also look at the need to attract funding for coalitions, that is really funding in support of coalition management, as opposed to just funding for targeted health objectives that includes some ability to use it for management. We wanted something that actually focuses on the coalitions themselves. And so we identified a number of areas to focus. Now we're bringing together a group of people that will include coalition leaders, it will include funders, it will include a number of people that are working on a large scale in support coalition networks of coalitions. And we're going to take a number of steps together. We're going to really look at who do we want to support specifically. We will be looking at how to design a framework for curated information. So this, the work that Sarah does so well with PHERN, we're looking at how to create a coalition and collaboration support track and resources. And we're also going to be looking at how can we bring coalitions actually into the alliance. The alliance has been a network of networks. It's a network of organizations. But we're also looking at the issue of, can we bring coalitions from around the country into the alliance membership? What would provide value to them, and what might they be able to do within the context of the alliance. We see this as the possible strategy towards getting broader public engagement in an organized movement in support of improving systems of support for the public's health. So these are things that we're going to be working on over the next number of weeks. It's one strategy among, as Angie said, a number of strategy areas within the Alliance to try to build up a broader, organized and very active movement that will have components focused on communications and advocacy and capacity building. We're looking forward to that next step. Any questions regarding that? Yeah, as we do that work, we'll be checking back with you all in Alliance meetings such as this and we'll also be having some future Alliance meetings focusing deeply on the role of coalitions in advancing community public health and what makes them work and what can support them on a large scale. I guess one final note on this. In the context of a broader strategy, we think it's really important to be able to convey to the country that public health is a community-wide partnership. I think a lot of public attention seems to focus on public health strictly as a government activity, and yet there's a tremendous amount of civic activity around public health, and we want to make sure that not only is that well understood, but that is recognized and supported as an integral part of public health system. So that's what's behind all this.
As is often true when you are working with folks in the federal government or the administration, timing is not everything. So we're still waiting for the general to join. If there's other things that people want to add or conversations or questions that they have, please take the minute and hopefully we'll have General Friedrich with us soon.
What is your communications related work focusing on these days? Oops, you're muted.
Steve, you're asking me here. So, you know, I think I shared that we started this Council for Quality Health Communication that we launched last year. We've been engaged, I guess, a big advocacy article in the Hill to try to get more investment in health communication. We wrote with Mark Weber. I think the example for everyone might be the Society for Health Communication that has another coalition and a meeting that's scheduled the 16th to 17th in June in Arlington, which has workshops in some of these areas, as well as opportunities for people to speak and network and so forth. And everybody, I think, can join for free, if I'm not mistaken. And we have a relationship, a partnership. Our Journal of Health Communication is the official journal with them now. So we really hope to leverage ideas at those workshops, everything for people that are interested in publishing, but more importantly, ways for action as a group of practitioners. And, you know, that's where we're really trying to do this, translate this research into action. And, you know, much like you said, Steve, we foster, you know, not my other role with CUNY School of Public Health and Health Communication for Social Change, the idea of partnerships and coalitions and ways down to the community level on equity and so forth. So there's lots of ways that, you know, we'd like to foster. I think, you know, Angie and APHA, all the work that you're doing, and Steve, I know you put this together from the beginning. So we're not giving up, but there's a lot of coalitions and councils and pieces there. Our council is really trying to bridge with different things than what when Jessica mentioned, but practical areas as well. And also the big, policy challenges that we face on both the domestic all the way down to local levels and even looking at the global level. So, with that, please feel free to reach out to us if we can help as part of this alliance and other areas. And I think, Steve, it goes back to the piece with Bill Novelli and Reed Tuckson's coalition that we're trying to give materials from our council. We have a new communication group between the two of us, so we can come up with the tips and tools that fit in the pocket or the screens on the cell phone that practitioners can use in interaction with the millions of patients that the coalition members are part of. So that's kind of our target audiences, and I think we all work together, hopefully not in silos, but also sharing the evidence as you've suggested here. Well, thanks.
Great.
And Scott, I think that you have just hit on one of the reasons why the Alliance can be so valuable is that there are all of these different tables that are working on very similar issues, but with different pieces, and bringing it all together will make us much more powerful. So we're not duplicating. People are working on the pieces that are important, but we are also value adding to those different coalitions. And that's really what we think might be missing in some of these conversations is that ability to do the the dog just decided to bite my thumb. The cross-sector issues and really do a much better job of building on each other's work.
Sure. No, I mean, and thanks, Susan. Just the last piece is that I know you started with the American Journal of Public Health and the Perspectives piece. Our Journal of Health Communication, we also have had some special issues, one sponsored by the Pandemic Response Institute, which is our initiative that we have at CUNY and with Columbia. We did one last year, No One Left Behind. We have one, even the interlinkage of climate and health coming out in June. We have something on misinformation, what works and what to do with different perspectives pieces. So that's all figure ways to get not only the peer-reviewed literature, but ways to translate this best practice. And indeed, this alliance can help support that. And we can support it any way we can.
That is a reminder to you and to everybody else on the call. There are more than 260 folks that information from the Alliance goes out to in a broad cross-section of organizations and activities. So if you do want to share, this is a really good way to do it, is just make sure that we have the information and we can get it out widely through the email and also using PHERN. So there are lots of opportunities that we all have to disseminate broadly.
And Scott and Jessica, if related to the work that we're doing on coalition support, if there are aspects of your work, and I think, Scott, you just referenced that there are, that would be appropriate in terms of resources for coalitions, particularly, we're focusing on coalitions that are resident driven, so that, folks that are not in formal public health positions, but are trying to work on behalf of better public health in their communities. If there are resources that you would like to make available to them, then as part of our working group activity, we'd be happy to sit down with you and go over those and look at what could be of value and how we could make that more available. And as we think about technical assistance, if there are TA resources in the realm of communication that you think could be valuable as well, that would be good to know about. So let me know if that would be of interest.
Sure. I think there's a number of people I see health leads, I see CUNY School of Public Health colleagues and others on the call here. Our group from our Vaccine Equity Cooperative and others, I know they're part of this 260 that Susan and Angie have mentioned. So, whatever we can do, just what the communication, if it's better than these calls are important, but if there's other stuff intermittently, I'm happy to engage.
Great.
I believe that the general has joined us. So let's see if Dr. Friedrichs is here. We'll give a minute to get his sound.
as we all wait for the connection to audio, I'll start the introduction, and so as soon as he's available, we can ask him to join. So I just want to offer Dr. Benjamin, and Dr. Benjamin is sorry to miss this briefing. He's on travel today, but he sends his best to you, General Frederick, and I want to have, it is actually my pleasure to introduce you.
Well, thank you very much. And can I just, yeah, hi, this is Paul Friedrichs. Can you all hear me? I'm having a little technical trouble on my end, so I apologize. Can you hear me okay?
We can hear you, and we have your slides up.
Thank you. That's wonderful. Just, I'll say first, thank you very much for the opportunity to spend a few minutes with you. And I think in the interest of time, since I was late getting through on there, I'll just say a few things. For those of you who I haven't met with before, our office was created by Congress as a result of the observation from the COVID pandemic that there was an opportunity to better integrate efforts across the federal government. So that's the primary responsibility that we have, is more closely integrating efforts across all the different departments and agencies. A second task that we were given was to reach out to key stakeholders and make sure that we have ongoing connections with them prior to an event rather than trying to build them during the event. Both of those are relevant in the context of avian influenza as this is unfolding. This is a really great opportunity to demonstrate the value of integrating functions, because this is a both animal event with a strong veterinary component, and also we have one human case with the human health component. Part of what we're finding in this as we go forward is that there are a lot of very dedicated professionals in the veterinary, public health, and infectious disease space involved in the animal response, as there are on the human side, and the processes are different. So we're spending a lot of time integrating across the two. I think the good news from our perspective is that although the number of affected herds has continued to grow, we have only seen the one human case. We are moving forward with some epi studies on the human side that we hope will help us better understand whether there may be asymptomatic cases or other cases out there, but to date have not found any others. Another encouraging data point is, of the sequences that we've reviewed so far, we have not seen significant changes in the area that is most closely associated with mammalian transmission. What we have a lot to learn about and are still working on here, especially with our veterinary colleagues, is why now? In the absence of changes in the genomic sequence, why are we seeing bird to cow, cow to cow, cow farms with 3 poultry farms, which is a really interesting epidemiological study that we're working through, and a myriad of other questions. So I believe that we are seeing a lot of great work being done, and I have heard many people expressing frustration about why we haven't come up with all the answers to all of this yet. I accept that, we would all like to have the answers to many of these questions on day 2 or day 3 of a response, but we are trying to be very methodical in stepping through how we do the analysis, as you all are very familiar. And we're also very aware that in this particular case, because it's involving dairy herds and migratory fowl and poultry flocks and rodents and humans, there's a lot of analysis that's going to have to be done to fully characterize what we've observed over the last 3 weeks now, and potentially even earlier than that. We learned of this on the 24th of March here in our office, but we fully recognize that there are some reports that suggest that this had started earlier than that. I think I'll pause there in the interest of time and see if that stimulates questions, and more importantly, if there is advice or things that you all think we should be addressing from your expertise and your perspective. If I may, Angie, throw it back to you.
Sorry, thank you. I really appreciate that. One question I think for you is just, we have a cross-sectoral group looking at public health. Are there ways that you have that partners could help with, dealing with things like these spreads or pandemics, or communicating about the information? How can we be helpful?
Yeah, thanks. So I'll start not specific to this outbreak. In general, one of, a broad task that we are working on this year is a report to Congress, which Congress required, so this is not an original thought, that describes best practices or what went right, what did not go so well during the COVID pandemic. One of the clear areas in which there was good and really great success in some cases, not so much in others, was in the linkages with key stakeholders. And we think that it would be much more valuable to have ongoing engagements with leaders like yourselves on a recurring basis rather than just episodically during an outbreak. And so part of what we are working on is what's the right cadence of interactions to share what we're working on and to hear what you're concerned about. The premise of that is that if we're having those regular discussions before the next biological event, and we know each other and you all kind of know who we are and what we're working on, it cuts down on the surprise factor and who the hell are these people, and I've never heard of this group before. Why are they calling and talking to us? So that's an opportunity to establish some regular interaction and some touch point with you all. Specific to this outbreak, I think it'd be helpful to hear your feedback on the information flow. I know CDC has been putting out regular updates of various sorts, just published some new guidance for veterinarians yesterday. The animal counterpart also has been putting out updates, also just published something yesterday. And then there's a variety of other products that are out there. Are those sufficient? Are they clear? Are they woefully inadequate? It would be helpful to hear your feedback on that so that we can continue to refine what we're communicating, where we're communicating it, and how we're communicating.
So does anybody have a specific question or a response to the general's request? If I may then, we have, as you understand, a cross-section of people, organizations who are part of the Alliance. And we would love to set up some sort of regular opportunity to engage and hear. But in the interim, what is the best way for people to get feedback to you so that they can, as they're looking at the materials, to see what's working and what's not?
Yeah, thanks. So I think you have the email address for Mira Rajagore, who is our special assistant who helps with a lot of our outreach efforts. And we can also share the email for Dan Hempling, whose primary job is engaging with stakeholders. You also have my email because I recognize a number of familiar names. People have been emailing me. I will say candidly, right now my email box is filling up faster than I can empty it because lots of people are sending me the same article, say, hey, did you see this article? And while I appreciate getting 18 copies of it each time it comes out, 18 copies just takes that much more time to open each one up and say, yep, I have seen it, thank you. So we're trying to figure out how to do that part a little bit better along the way also. So Mira and Dan are great contacts. I'm also very willing to receive emails and phone calls and just ask that everybody does not have to send me the same information just to make sure that I got it, if that makes sense.
We'll make sure to get those 2 emails out to folks so that they can help triage for you as you're going through and reading all of the articles and getting all information. Again, now is a great time for people to ask questions. Raise your hand or put it in the chat. And Jonas, are there other things you want to share with us?
Well, again, I would just say, you know, I'm assuming from the silence then that everyone feels they're getting the right amount of information at the right level at the right time. If that is not the case, please raise your hand and tell me where we're missing the mark, because we are truly, I mean, part of when Dr. Benjamin and I talked about this, we are truly trying to figure out what's the right cadence and the right level. So I'm assuming silence in this case means everybody's ecstatic and that we are nailing it. If that's not true, we'd love to hear that feedback. Okay, well, I'll go with that we're nailing it right now. So a couple of other things specific to this outbreak, and you know, as you all are thinking about this in your respective roles, I really want to emphasize the point that, you know, we've been talking about avian influenza now for more than 20 years, or right at 20 years. And every time we see something interesting, we say, oh, here it is. We told you it was coming. Here it is. I'm not certain that we know yet what the scope of this outbreak is. I'm not ringing the alarm bells yet. It is the first time we've seen it in cows. It is the first time we've seen cow-to-cow transmission, but certainly not the first time we've seen transmission within a species. It's the first time we've seen cow to human, but not the first time we've seen mammal to human. It's the first time that we've seen species to species transfer beyond birds, you know, from cow to poultry, but not the first time we've seen it among other species. So we're trying to be measured in describing what's happening here. We're also trying to be very thoughtful about how we reach out to the workers in this space, because as many of you are aware, the workers on farms come from a varied background and different socioeconomic status and a host of other things that we've had to be very mindful of in the public health and the primary care space for a long time. This is an area where I think there's work still to be done. And so I would ask of the folks who are on the line, if any of you have particular expertise working with farm workers or those in farming communities, it would be very valuable to hear your feedback on, or your observations on best practices, how best to support this community. We've been soliciting this feedback from a lot of experts along the way, and see quite a few experts on the phone here. So love to hear your thoughts on that. Scott, I see a hand going up. Go ahead.
Yeah, I'll only, so this is Scott Ratson. I've been engaged with health and risk communication, and I actually wrote a first edited book on the mad cow crisis, health and the public good, in 1998. So you can do a little search. I wrote something on one mad cow sets off a stampede that was in the New York Times and other places. So I think you're on the precipice of some challenges, and later sat with USDA and a variety of interagency groups to try to figure out ways to communicate. So, you know, all I would say is the cattlemen's groups, you know, all the different, I'm sure you've done all this analysis. And I don't know how often you're doing your oral briefings with the main stakeholders, which, you know, I hope you would do or have been doing. So you know, all I would say is judging from the communication thus far, we may have dodged a bullet, but yet the human transmission, I think, is an issue that with misinformation and how this could be blown out of proportion, you know, something can happen very, very quickly. So I hope you have a lot of risk mitigation pieces in place. We did publish in that book, and also with the WHO, on you know, maxims or checklists and so forth, and a lot of other people on this call, I'm sure, are engaged with it. But you know, I would say that you know, do communicate with this group and realize that the human health component is the one that scares our audiences, but as you're saying, working with farm workers and all the others, it's really key as well on the appropriate prevention measures.
We have time for probably one more question. If not, then maybe I will ask this, and I don't know if it's fair to do this with 2.5 minutes left. But if we're looking ahead, are there things that we should be looking for? Do you have any predictive models about what the next issue might be?
In the avian influenza outbreak, or in the economy, or in politics, or Which of the many, and I'm being a little tongue in cheek just because it's been a day and you have to have a little levity, but can you scope that just a bit?
Sure. So we understand that you are engaged in following with Avian, but if we're talking about the next area where pandemic or emergency preparedness might be necessary, what is it that you think we should be looking at?
Yeah, so I think as we look at the pace of biological events, they are increasing. And as we look at the impact of those biological events, they're becoming more severe. Now, that's not to say that I'm worried about Ebola showing up as a pandemic globally. That's not what I'm saying at all. But I do think we've got the confluence of lowering vaccination rates, which is increasing the risk of vaccine-preventable illnesses. We've got a whole host of climate-related changes, which is increasing the frequency of things, or at least contributing to the increase in frequency of a variety of vector-borne illnesses. And we've got the really remarkable things specific to the United States with declining or plateauing life expectancy and relatively high morbidity levels that predispose people to significant health challenges when confronted with an infectious disease. So those three data points are of concern. Then you add in that we have a significant workforce challenge in the United States, 400,000 nurses shortage, 80,000 doctors shortage. You can go down the list of veterinarians and pharmacists and others. So we have an access challenge across the board, and some communities in particular have even worse access challenges, often in communities of color or in rural areas, underserved communities for a variety of reasons. We know about half of Americans have access to a primary care provider. The obverse of that, then that means half don't. So when we design perfect programs for primary care providers to execute, awesome if you're in the lucky half, but not so much if you're not. And then we've got this challenge of skepticism about the advice that we provide. You know, the last survey data that I looked at said that 39% of adult Americans are unwilling to accept the vaccine if recommended by their medical provider, even if the data shows it's safe and effective. Now, there's some caveats to the study, and there's all sorts of yeah, but this and yeah, but that. But I think when we put all of that together, what it adds up to is we're in a tricky space in which we have to regain trust by being very, very truthful and transparent. And as we seek to be truthful and transparent, we have to do as good a job as we can, and I'm getting back to your point, of describing risk. I mean, there's a million horrible things that can happen. But when we come in and say, well, you know, if I don't get funding for this, awful things will happen, we diminish the credibility of our voice when we then warn people about something happening. And so we do have to be careful about how we frame things. Part of what we are working on is, you know, what really happened over the last 4 years? What should we learn from it? And how should that inform what we as a nation are doing to better prepare for future events? It is going to be a very wide-ranging report, and we look forward to your input on that as we go forward. But the key thing on a day-to-day level as practitioners to look for is something that you haven't seen before. That's going to be, I think, the red flag that we will continue to trust our clinician colleagues, the frontline colleagues, to do is help us understand when they're seeing something they haven't seen before so that we can look at that in the context of all the other data that we have. Sorry, that covered the waterfront on a whole host of issues, but I hope that that was helpful.
Thank you. It was very helpful, and I think it also pointed out the real value and importance of all of us working together to assure that public health as well as the clinical workforce is as robust as it needs to be to address some of these future concerns. So with that, and on that happy note, General Friedrichs, thank you so much. We really appreciate you taking the time with us today to provide this briefing. We understand how busy you are. I cannot imagine what your email looks like. And so we are here to help, and please let us know what we can do to be helpful. To all of you who are part of the Alliance, we will see you next month. But in the meantime, as Angie said, if you have any questions or follow-up, please be sure to email us and we will share that information as appropriate. So with that, enjoy the rest of April, and we'll see you next month. Donna, did you have a
Thank you
question?
all. Thank you all very much. See ya.